Good afternoon, Ed. Thanks for joining us. We'll get started here in a few. So, look, are you all set to go on your end?
All set to go. Thank you.
Your camera looks good. And sounds good. So that's got those covered. So we'll just get about 10 minutes. We'll get going.
Okay, I'll be here.
Thank you. Jeremy, if you want to do a quick sound check, that'd be great.
How's this, Brian? Can you hear me?
Yeah, that's good.
Pretty good.
Good. Dr. Trapp, hi, good afternoon. Can you just do a quick sound and audio check with us?
Sure.
Great. Okay,
John Trapp, Bryan Medical Center.
looks great. Thanks. Just a couple minutes, we'll get going. Thanks.
Thanks so much.
And Lori, can we do a quick audio visual check with you?
Yeah, can you hear me?
Yeah, you're a little dark, you're a little shadowy there, but in the light. That's a-
Yeah, it is shadowy. Normally it's not like that.
I think you're backlit more than normal or something, so.
Is that better?
yeah, That's great, thank you.
Okay,
And
you
your
bet.
audio is great, thanks.
Okay, good.
Hi, good afternoon. This is Brian Noonan with NHA. I'm trying to keep up with everybody as they come in, but if I haven't made you co-host, which means you'll be allowed to record this yourself, please chat now in the text for me. I will send out a recording as well to this group as a backup, so know that. But yeah, again, if I haven't made you co-host, please let me know. Thanks. We'll get going about 2 minutes. Hi again, Brian Noonan with. Oh, that was interesting. Okay, thanks Zoom. Okay, we are ready to get going, and without further ado, I will introduce Jeremy Nordquist, President of NHA. Jeremy, go ahead, take it away.
Thanks, Brian, and thank you all for joining us today. I'm Jeremy Norquist, President of the Nebraska Hospital Association, and in my role as President of the Hospital Association here in Nebraska, I talk to hospital leaders from across our state and hear firsthand about the challenges they're going through. And as part of that process, we want to be as open with the public as possible, sharing with the public what's going on inside our hospitals every day. So that's why last week we started this series of press conferences, and I'm very happy to bring together some distinguished hospital leaders in our state to speak with you today and to share what's going on in their hospitals. There's no doubt we are still in one of the darkest times of the pandemic right now. Just going back to December 26th, our positivity rate has gone from around 11% up to about 27%, more than doubling. We've seen hospitalizations from December 26th go from about 440 hospitalizations in our state to around 650. An increase of well over 40%. And this is going to be with us for a little while longer. We're expected still among COVID positive cases to be a few weeks away from the peak of that, and hospitalizations tend to lag another week or two from the peak of COVID positive tests. We also know that rural Nebraska is lagging the rest of the state, and urban centers around the country. Rural areas are lagging in terms of their positivity rate. So we have a long haul ahead of us over the next 4 to 5 weeks with COVID in our state. And today on MLK Day, you know, if you've ever been to Washington, D.C. and seen his monument on the side, it says, out of the mountain of despair, a stone of hope. And really, that's how I view our hospitals and our hospital leaders right now. We have a lot of despair in our communities and across our state with COVID, and our healthcare heroes are doing tremendous work, trying their best to care for their fellow Nebraskans. So with that, I'm going to introduce our 3 speakers today. First, we have Lori Mazanek from Box Butte Hospital and Alliance. We have Ed Hannon, president of CHI St. Francis in Grand Island, and Dr. John Trapp, vice president of medical affairs at Bryan in Lincoln. We're really excited to hear from them about what's going on inside their facilities, staffing challenges they're facing. So with that, we'll start with Lori and then go to Ed and Dr. Trapp. Thank you.
Great. Thank you, Jeremy, for the introduction. Like you said, I'm Lori Masnick. I'm the CEO at Box Butte General Hospital in Alliance, Nebraska. We're way out west in the Panhandle, about smack dab in the center of the Panhandle, for those of you that don't know. In the Panhandle, we work with Panhandle Public Health District and really kind of follow the cases that way, along with what we're doing here at Box Butte General as well. But COVID cases jumped from 291 the week of January 3rd to 562 January 12th. This is a 93% increase, which shows how quickly the transmission can be. It does seem that there's about a 1 to 2 week lag from what's happening on the eastern side of the state right now. And so we're expecting our numbers to continue to increase. Also, we have had 8 COVID inpatients in the Panhandle Public Health District area. So that's all of the counties combined in that health district, with 3 in the ICU, and that was on January 3rd. And as of today, with recent numbers, the number of our COVID inpatients has doubled to 16, with 6 in the ICU. And this includes 2 COVID inpatients at Box Butte General Hospital. We have been fortunate and not seeing as high of inpatient numbers pre-holiday, but we're starting to see those numbers increase across the Panhandle. We cannot stress enough the importance of staying home if you're ill. That's really what I'm trying to push for our community. As with anything, you know, not only COVID, but just with anything, just because the symptoms are so similar across all the illnesses right now. And because of the contagiousness of this and this new Omicron variant, staying home is so crucial to preventing the transmission. The biggest challenge in Alliance and many of the critical access hospitals is getting patients transferred to a higher level of care when it's needed. We've been fortunate in the previous 3 weeks that we had a little bit of it's been a little less intensive to transfer, but that window's closed again. The difficulty is not only for COVID related transfers, but all types of patients that are experiencing an illness. And because the big hospitals are full, it just has a rippling effect on our smaller hospitals when we rely on them for continuing that higher level of care. Local resources are being exhausted, and we're calling between 40 and 60 hospitals to get a transfer for a single patient. And so that's very time intensive. And that's across the Midwest and even further. It does cause significant delays in the advanced care affecting our patients. Our teams have been relentless and provide exceptional care that needs to be done while we're waiting for that transfer. And that can be, 24 to 36 hours later. And it's been, essential these last 4 or 5 months. We too are facing critical staff levels. Some are leaving healthcare altogether is what we're seeing. We have quite a few out due to illness, and we're starting to see many others pulling extra shifts multiple times a week. As like all industries across the state, it's just not unique to healthcare, but it's been a challenge to fill a variety of openings. And for us, that does include nursing and physicians. I will say, just to close out though, that our community has been the most gracious and kind as we face these challenges together. And I continue to be grateful for the understanding and patience as we navigate the days ahead. and do remain hopeful that this does level out and see declining numbers right around the corner. Thank you.
Thank you, Lori. Appreciate that insight from what's happening out in the Panhandle. Now, Ed, what's happening in central Nebraska, Grand Island?
Great, thank you. Appreciate the opportunity to be here today and talk to all of you. So here we are in Grand Island, Nebraska, 22 months after this pandemic first began. And as many of you know, Grand Island was really one of the first places here in Nebraska that really saw the COVID virus start to hospitalize patients. And it's been one long ride for all of us, and we certainly would look forward to an end of this whenever it comes. I could go on, and Lori did such a great job. We all are facing many of the same issues from lots of patients, not just COVID patients, but other patients, difficulty in bringing more in, and what's our capacity, trying to get patients in, trying to get some patients out to a different level of care. Here in Grand Island, we're a 100-bed facility with a level 3 trauma center. So there's always a need for people to come here to Grand Island from all over the state. And we do our very best to accommodate anybody who wants to come here. And it really is hard to say no, that we are at our capacity as well. So our numbers may be different, but the message is really the same here across Nebraska. COVID is still here. The Omicron virus is relentless. It's highly transmissible. The best thing that any of us can do in our communities, whether you're a healthcare provider or not, is to keep socially distanced, to get the vaccine. Let's not, require it for everybody. Let's just do the right thing and get vaccinated. We know that this is still largely a disease of the unvaccinated, and that those who aren't vaccinated or aren't booster, when they get this virus, they get sicker, and then they often do require hospitalization or even our ICUs, or to be on ventilators, and we certainly don't want to do that. Our hospital, one of 14 hospitals across Nebraska and Southwest Iowa, we're all seeing about the same percentages in our numbers. We're all seeing that we're full. We have about 25% of our beds currently are full of COVID patients. The others are taking care of other patients in our community. About 70 to 75% of the patients who are hospitalized are not vaccinated. And those who are in our ICUs or on ventilators, typically over 90% to 95% of those were not vaccinated. So it's pretty rare that somebody who has been fully vaccinated that gets the booster shot ends up getting in somebody's ICU or on a ventilator. So that's really part of the message, is it's not too late to get vaccinated. It's not too late to get your booster and to stay healthy. Just as Lori had said, staffing is an issue. Our healthcare workers, while they are superheroes, and I love every one of them who stays dedicated to this field, they're not immune from this disease. And while many of the employees have said this has been the great retirement, or they've moved on to different careers this year, they're also getting sick. And we know that here across CHI Health, our 11,000 employees in those 14 hospitals, that we have about 400 of our employees who currently are out ill at home, trying to recuperate from being exposed and now testing positive to COVID. Here at St. Francis, here in Grand Island, we have over 40 of our own employees who are out ill, not able to come back to the bedside and help care for the community that's in need. And that's my guess would be, no matter which hospital president, CEO you asked across Nebraska and Iowa, you're going to find similar percentages, similar numbers. So that's really where we're at with our staffing. Many are out ill. Love to get them back to work. More patients than we would really like to be able to take care of with COVID. But we're here, not just for the COVID patients, but for those heart attacks, those strokes, those injuries, and all of those surgical things that need to be taken care of. So yeah, we're here, and I'm happy to take some questions as we get to the panel discussion later. Thank you for allowing the introduction.
Thank you, Ed. Dr. Trapp.
Thanks, Jeremy. Great outline by the other two CEOs at hospitals across Nebraska. So John Trapp, my background is in pulmonary critical care medicine. I currently serve as the Chief Medical Officer here at Bryan, helping our team steer our hospital system through the pandemic. As has been outlined, increasing numbers, positivity within Lancaster County, leading to increased hospitalizations. Just to give you a sense of that, we had 543 with our census this morning. That's significantly higher than normal for us. Over 100 of those patients are related to COVID illness. As far as bed capacity, that remains a critical issue for us. Having enough beds to take care of patients. Currently, as of just an hour ago, we were holding about 20 in our emergency department, looking for beds to get into the inpatient status. At the same time, our critical care access hospitals and other hospitals across Nebraska trying to find hospitals to transfer to. So we had 19 on the wait list. We do keep a wait list for potential transfers. A number of those are ICU level patients simply not able to get transferred to our hospital or other hospitals for those specialty care needs. Some of these are COVID patients, others are surgical patients or other highly complex disease processes that just need that additional higher level of care. Frustration for us, I would say our bed management system is doing the very best that they can, work very closely with our hospitalists, our surgeons, our intensivists to try to risk stratify patients to get the patients most needed here that need more of an urgent procedure or intervention. We continue to use all of our contingencies available to us to support our workforce. We have float pools, we fill holes with additional staff, so reallocation of staff to support our other areas of the hospital the best that we can. We continue to restrict surgeries, so we do not allow any surgery that requires an overnight stay that is not urgent or emergent, meaning needs to be done within 30 days. We do continue to do some ambulatory surgical cases, which does not impact our inpatient care. We continue to have visitation limitations of 2 visitors. We continue to expand our ability to have visits for COVID patients. Continue to support our community in any way we can. Lancaster County reinitiated their mask mandate the end of last week, and we continue to support Lincoln Public Schools in masking as a prevention measure. We continue to use our media the best that we can to promote vaccination and boosting, really educating the public to wear masks where appropriate, avoid high-risk situations, particularly as infectious as Omicron has been. We've continued to support masking throughout our facility and really promoting kind of sealing the mask. So seal the deal with your mask to minimize your risk. Masks are great. Simple surgical masks are great for primary prevention, but trying to minimize sickness to our staff with masks. We wish we had enough supplies that everyone could have a KN95 or an N95 mask, but right now we're supporting everybody with masking, goggles, everything we can do to help minimize staff's risk. So again, capacity remains a primary issue. Workforce is extremely important. Supporting our staff, our physicians, that level of fatigue that's been going on now for 2 years as we see rising numbers and anticipate that these are going to rise even higher. Those are all of our concerns. So we continue to support our own staff as well as try to support our referring hospitals the best that we can with access to those higher level of care.
Thank you, Dr. Trapp. And as our presenters mentioned, the importance of vaccination, we do know from state DHHS data now that you're 46 times less likely to be hospitalized due to COVID if you've gotten your booster. So we certainly, all of us across all of our hospital systems, want to make sure that we're encouraging Nebraskans to do that. It's never too late to take that step, and we really encourage those 35% of Nebraskans who have yet to be vaccinated to start down that path. A couple questions have come in here so far. I'll kind of roll the first 2 together. First is, how close is your hospital to implementing crisis standards of care like UNMC? And related to that, are your hospitals delaying any procedures or appointments to be able to keep up with critical patients? Or if not yet, is this something that you expect to have to do in the next few weeks? Lori, would you like to go ahead?
Sure, I will. Yeah, I'll take that question. We have not had to implement our crisis standards of care. We just continue to monitor the census daily. Each week when we have, different surgeries scheduled, some elective, some not, we really take a look at the census. And in the past, we have had to postpone surgery. So, even in the critical access hospitals, we're having to do that too. Just, knowing that our beds are full and we just can't do those surgeries at the time. So we'll just continue to monitor going forward.
I'd like to chime in on that.
So I'll step in and say CHI Health is not enacting the crisis standards of care yet in our hospitals, many of the hospitals in Nebraska or Southwest Iowa. We are stretched thin, but our staff continue to provide the heroic care to our communities that we serve. We're at a level that's referred to as contingency care, which means that we adapt daily to the patient staffing and bed availability. Our patient loads and our staffing needs have grown exponentially, especially over the last 2 weeks. We currently have over 200 COVID patients within our hospitals. As I mentioned, 91% of these are on ventilators and are not vaccinated. So our workforce is tired. We have many that are out. As I said, about across the division, that's about 400 of our employees are either quarantined or tested positive. So it's definitely putting a stress on the system, but we are not at the crisis standards of care level.
So from Bryan Medical Center, we talk about this on a regular basis. We spoke about this morning with the recent events with Nebraska Medicine. Certainly respect the things that they're doing with regard to crisis standards of care. We continue to use every contingency we have available to us to manage patient flow. Very concerned about as patient numbers go up, when we will transition to crisis standards. That's always a concern. And it's a very fluid time. This could change very quickly. Should we have increasing numbers of patients in our emergency department, increasing referrals that we just simply can't place. But again, something that we discuss all the time, but want to continue to exhaust all contingencies that we have available first.
This question was directed for Ed. Can you share the number or percentage of staff that are out because of COVID or quarantine, and any more detail about the morale of staff in your hospital? Sure.
So I think I mentioned here across the division, all of our hospitals, it's about 400 out of the 11,000 employees who are unable to come to work. Here in Grand Island, that number is roughly about 43, I think is what this morning's number were, out of the 750 employees who work here on our campus. I mentioned that staff are tired. They've been dealing with this for almost 2 years, patients coming in. And they would love to see an end to this. It gets sometimes frustrating for staff to know that for many, this may actually be preventable. If they would just get the vaccines and the boosters, they could keep themselves from getting sick and getting hospitalized. So they would love to see everybody get in line and get vaccinated. But they know people have choice, and many people have chosen not to get vaccinated. And so when they do come in, they do their absolute very best to be here every day, tirelessly, 12-hour shifts. As mentioned by others, we're short-staffed. We could use more of our nurses to come back that are out ill, but our staff work extra shifts. They may work an extra 1 or 2 shifts per week to come in because they know people need care. And that's just what people in healthcare do, is come in when there's a need. And so they're there to do that. So our staff, I would say morale is good. They feel energized. They know they're doing the right work. They feel blessed to be able to give of themselves to the patients who are here. That's what they were called to do. It is their mission. But they're tired, but they still come to work every day knowing that that's the right thing to do.
Yeah. We had a couple questions come in related to vaccination, and one is, how worried are you that these dire messages will fall on deaf ears with the disease being, especially the hospitalizations being so focused on the unvaccinated? And are we seeing any more interest in vaccinations in your community, in your hospitals? I certainly, for the first question, trust that, and it's kind of why we as the Hospital Association decided to step up and do more of this proactive communication. Trust that, when Nebraskans get the information, sometimes it's tough breaking through all the information that's out there, but when they get the information, they're going to make smart decisions for themselves and their communities and their families. So that's why we're out there doing this. So we're certainly from the association perspective, optimistic that Nebraskans will make the right decisions. But Lori, Ed, Dr. Trapp, thoughts on any seen more interest in vaccinations kind of as we've been going through this new Omicron variant?
I'll go ahead and speak to that. We have seen a little bit of interest, not, huge waves of it, but just a little bit more of the public asking about vaccinations and actually receiving their first and second doses and even boosters. I think to echo what you said, Jeremy, just, public education and ongoing education, just continuing to get the good information out there. And like you said, Nebraskans will do the right thing.
Yeah, I would agree. As I talk to the health department, as I look at some of the vaccination numbers, the numbers continue to rise slowly. So more people are getting vaccinated, not in droves, but there is at least some getting vaccinated who may not have in the past. I think what my hope would be, and the gift that you could give to every healthcare worker across the state, is the masking. We know that this is a highly contagious disease, and we know that masking works. So if you are coming in, especially into a hospital where we're taking care of the vulnerable, the sick patients, please wear your masks when you come in, and we're allowing you to come in and visit with those patients who love the visitors, and it's good for them. But help protect our staff, help protect those patients, wear your mask. You may not even know that you have the virus. And by you protecting yourself, by wearing the mask, you're protecting all of us who are still here in the healthcare and all of our other patients who are in the hospitals.
So Jeremy, with regard to vaccination, again, we are seeing the same limited increase in vaccination with regard to completely unvaccinated versus getting your first vaccine. We're really trying to push the booster. We know that makes those numbers you quoted of 46 times less risk for hospitalization, severe illness. That's with the booster. I've seen numbers of 7 to 12 times reduced risk of hospitalization, severe illness with just a primary vaccine. So really trying to educate people that is the primary prevention. People are also reading about different therapies that we might have available for patients at risk for severe illness. The sotrovimab, monoclonal infusion, or some of the oral therapies now available. People just need to understand those are very limited in quantities, and they're going to be very restricted to individuals at highest risk. We certainly don't have enough to go around with the numbers of positives that are coming out. So as has been said by my colleagues, primary measures of masking, reducing your exposures, minimizing crowds that may be at risk, and those are the main things that we can do to really reduce the spread of this very infectious variant.
And I think that kind of addressed the question about other specific solutions, but obviously masking and being judicious about being around crowds or just not, especially if you have symptoms. Any DHMs issued by the state that would be helpful at this point? Directed health measures from the state? Anything that you all would point to? I'll just say, and there's another question here about what the state and local governments could do to help. We are working with the state, and I think we'll see some movement very soon on the state helping open up some additional skilled nursing facility beds that would allow hospitals to move out patients who are ready for that level of care. But unfortunately, we're seeing a similar staffing crisis with our nursing homes across the state. So they're not able to open the beds that we need, and it's creating a bottleneck for post-acute placement out of our hospitals. So I think the state has a solution. They've been working on it with us and with the nursing homes over the last few weeks, and I think that'll be coming forward very soon. That'll be a little bit of a relief valve. Certainly doesn't solve the problem, but that will help. And we continue to have conversations with our elected officials. There's a lot of funding available through the American Recovery Act at the state right now. Governor Ricketts just put out his budget last week and made a commitment of around $200 million of that funding towards healthcare, some to help us with immediate capacity needs. Obviously, some of that still has to go through the legislative process, so it won't be available tomorrow or today when we need it. But we're in ongoing conversations about them, and hope to have a successful legislative session when it comes to taking care of our healthcare workforce right now and investing in rebuilding our healthcare workforce after the pandemic. Let's see here. How many COVID patients have insurance? How are hospitals recouping the cost of care, traveling nurses, overtime, etc.? Anyone kind of want to try to take that one on?
Well, we don't have, I don't have the right numbers in front of me to know how many COVID patients have insurance or how many do not. We just kind of take that one day at a time. And, we've got, financial assistance policies in place to help, support us that way and support our patients that way. It's just making sure we can take care of those patients coming in the door, making sure we have that bed availability and knowing we have access to care. I think is the biggest thing, making sure we can take care of our friends and loved ones.
And I just emphasize that COVID is not a disease of the uninsured versus the insured. COVID affects everybody who's exposed to the illness to varying levels. Again, for many people, this is can be a mild or a moderate illness. It's only in those cases where it's most severe, requiring hospitalization, ICU care. Those have expensive outcomes when you're utilizing ICU resources. So that's always a concern. We find ways to support that, and probably can't give any other specific details with regard to the exact cost, but I just want to emphasize this is not a disease of the uninsured. This affects all people across the spectrum.
Can you talk about the role that traveling nurses are playing in your hospitals, and maybe some different perspectives from Alliance to Grand Island to Lincoln, and how those are helping with balance out the demand for services?
It's an ongoing balance for sure, and challenge. We're all competing for the same travel staff. It's become a pricing war. Who's going to pay the most on whether you're going to get a nurse or not? Sometimes location makes a difference, or volume makes a difference. There's not enough availability out there to fill all the positions. So I know we still have, vacancies in our nursing positions and other positions that we rely on agency staff for, as I'm sure both Brian and CHI do as well. If we're lucky enough to get somebody to come out to Alliance, it does help fill the void. It's just a matter of finding the people.
Yeah, I would agree. And I would also just emphasize it's not, as Lori said, it's not just nurses. It's respiratory therapists, it's lab techs, it's imaging technologists, it's really all of the hospital disciplines there is a need for in all of our hospitals. And we are competing for them. And when the wages get so high, people can sometimes work for a few weeks, a few months, and then they take time off. So that only compounds the matter more, because it does take then those people out of the workforce, as they may be taking, for instance, the winter off someplace south. And then we'll come back and think about getting back into the workforce in the spring or the summer. So it's a very complex issue and very difficult. It's certainly not that hospitals wouldn't bring them in. We all have vacancies for hiring full-time, part-time, permanent staff, and all of us are willing to bring in that temporary traveling staff if we could find to bring them in to help care for our communities.
I agree. Travelers are both a great help, but they're also almost a scourge. They're helpful because we all like to have them. We have travelers currently on staff that are filling holes, that are extremely talented staff. On the other hand, our own nursing staff are getting recruited away to become travelers for salaries that we just simply can't support. And so it's really a challenge to keep those staff here, to retain them and let them know the value they're providing to our organization. When sometimes they're getting recruited to go as far away as Omaha. That's a real challenge when they stay in their own home, but yet drive a few extra miles to get paid 2 and 3 and more times than what we could afford to pay them here. Meanwhile, we have some travelers actually have come from Omaha here in Lincoln. So it's a real challenge. That it's a war that we don't want to get in, and actually a war that no one wins.
Julie Anderson asked, back to that state solution I talked about on skilled nursing, when do we expect an announcement? I'll let the state handle that. I hopefully, it sounds like within a week, we'll have an announcement on that, but I'll let the state handle the announcement there. Brian Mastery asked, we've been talking about Nebraskans doing the right thing for 2 years now. Isn't that why we're here? Nebraskans aren't doing the right thing. The Attorney General suing Omaha for the mask mandate. Isn't that the wrong message? I'll let our guests speak to it as well. But you know, from my perspective, we're at about 67% of Nebraskans who, at least when it comes to vaccine, have chosen to do the right thing in that way. We know there's a lot of Nebraskans who do the right thing when it comes to masking and avoiding large gatherings, especially at this time. I think that the message that we're trying to get across here is the severity of the consequences right now. The Med Center's actions and the contingency actions that many of our hospitals are having to take just show that, you know, you're not going to be able to count on every healthcare service that you're used to. And, you know, it could be a loved one in your family that's their cancer surgery is delayed, or other needed surgeries are delayed. So we're hoping that message resonates with Nebraskans, because it really could impact any one of our families at any time where needed healthcare has have to be pushed off a little bit because the workforce isn't there and our hospitals are over capacity. I'd let anyone else chime in on that question.
Well, I think by Jeremy and the NHA, you know, starting to put these informational sessions out, I think that's one step in the right direction. To your point, yes, over the last 2 years, the vaccine's been available just over a year now. So it just takes some a little time, but I think the importance of us just continuing to speak about, you know, what's happening in our unique areas and putting the message out there consistently is going to make a difference.
We'll wrap up here with two last questions related to testing. How is the lack of timely testing compounding the hospitalization problems? And when it comes to at-home tests, would you recommend using them, and when?
Well, testing remains a really important thing here in Lancaster County. We have our urgent cares. Last week, we're really overwhelmed with individuals seeking testing and timely testing, either to return to their jobs or kids to get them back to childcare. All of those reasons to be tested. We do have some available testing through NOMI, which provides it here, but they quickly became overwhelmed, moved from a walk-in status to appointment status. Last week, we were walk-in status and we're moving to appointment status just to allow people to schedule a time to get their test done. But testing is a major concern because people just can't get access to that. Now, does everyone who has an exposure need a test? No. You know, at this point in time, if you come in with a high-risk exposure and you've got classic symptoms, cough, chest congestion, fever, I'm going to tell you more than likely or not, you've got COVID or some other viral illness that probably means you should stay at home. You should minimize your exposures and you should isolate. If you need testing, schedule an appointment to get that done. The second question came is, when it comes to home tests, typically home tests are the quick tests. These are antigen tests. These are most helpful when you're symptomatic. You know, after you've been symptomatic for about 24 hours, those tests are very helpful, and a positive test can confirm what you likely already know as having COVID. They're not as helpful if you have no symptoms. So they're not very good for screening or asymptomatic patients.
Right. That'll be our last question for today. Really appreciate everyone's time for joining us. And as always, if you have questions about what's going on in hospitals in Nebraska, feel free to reach out to the Nebraska Hospital Association, and we'll continue these conversations. Thank you.
Thank you all.
Thanks, Jeremy. Thank you.